Welcome to the Dr. Dana Show. We have a very outspoken guest today, Dr. Hooman from Beverly Hills, the spine pro. He's an orthopedic surgeon. He basically specializes in spine surgeries. He's basically become a patient in the system. So now we have a doctor who's become a patient, and he's seen many problems with the system. Welcome.
Thank
you
you
for
very
coming.
much. Thank you very much for having me. I appreciate
Yeah.
it. Thank you. Pleasure to be here.
So tell the public a little bit about your journey as a physician, now on the other side, as a patient, and what happened to you over the last 10, 15 years.
So I'm an orthopedic surgeon, started my practice in 2005, and about 2012, I had a little bit of basically a weird injury to my knee. It wasn't really an injury. Noticed, basically, it was kind of an incidental finding. Like I found out I had a little partial rupture of my quadricep tendon. It was a very small rupture. And I was very athletic at the time, playing soccer at a very high level, and I was kind of worried, like, oh my God, what if the whole thing ruptures? But the rupture was so little that it didn't, in hindsight, didn't really require anything done to it because I was not really having any problems with it, and I was not having any knee problem, and it was like more like a chronic thing happened, maybe stress related from overuse. And quadricep tendon is one of the biggest tendons in the body that you can people actually use part of it to use it for other reasons, like for your ligament reconstruction. So yeah, so you can actually sacrifice. So at the time, one of my colleagues at the time I was like, we should fix it. He's like, yeah, he should fix it. You know, he didn't really tell me, don't worry about it, let's do it. So I kind of went along with it. So I kind of had it fixed, and it really messed me up since because I started developing knee problems that I never had before. I never had knee pain before. I never had any issues. And unfortunately, it went on for like 4 or 5 years. And I kept telling, like, listen, I think there's a problem. He kept saying, no. Well, there was a problem. I ended up damaging cartilage behind my kneecap. Okay. So finally, I went to go get another opinion from another colleague. And he saw it. He said, yes, yeah, this is the problem. This is what happened. Yeah, you probably didn't need the surgery, but it is what it is now. We're going to fix it. So now we're going to do all of these things to fix it. Yes. So that was about 6.5 years ago. So when I woke up from the surgery, he tells me I did not do one of the critical part of the surgery because you didn't need it, even though beforehand it was like it's a must. After the surgery, I was like a little bit kind of skeptical, but I was like, I'm going to give him the benefit of the doubt. Okay. The first thing I noticed immediately after the surgery, I was having a lot of what's called crepitus, meaning there's like the pops and cracking that's happening under the kneecap. Right. Like literally just with just motion like this. Like
you could hear it. Bit of motion.
Like you sitting there, you could hear it after the surgery. So first it was attributed that, well, you just had surgery. There's a lot of knee swelling. That's normal. Okay. So 2-3 months go by, my knee's back to normal. There's no swelling. I'm hearing it still. And especially if you put your hand on it, my God, it was like your hand would shake underneath. Yeah. So I kept telling him, and he kept blowing it. It's no big deal, this and that. So then I did literally rehab for almost like 3 years, 4 years rehab. Wow. Kept injecting PRP. I was like I'm trying to get back into it. And the other thing was after the surgery was disappointing. Now I find out for the first year and a half, no rehab. He said, I don't want any rehab. You just need to bike and range of motion. No strengthening, no nothing. So my quadricep actually at the time, like I lost about almost 4 inches. Wow. Literally 4 inches of my quadricep lost. So it was a nightmare getting it back. I had to do so much therapy. Now I know in hindsight, you start therapy within the first week. You don't wait a year and a half. Anyway, I was able to, I did everything I could, but I feel the knee is not right. Okay. Like I can't squat down. I cannot go downstairs. Like I can't run. Like I can't do many things. I feel like there's pressure in my knee. Something doesn't feel right. So I did my anti-inflammatory diet, like everything, like holistically imagine I did to take care of myself. I'm not getting better. So finally I started seeing other colleagues of mine around LA. And they're like, yeah, this is not good. This is bad. We're going to try to do surgery. But I just didn't get any confidence, like, they're going to do the right thing. And if they were going to do it, were they going to do it right even? Like, I didn't get the confidence, like, is it the correct surgery they're going to do? And if they do it, so I was very disappointed. So I was like, listen, I'm an orthopedic surgeon. I know, like, there's got to be, I know the knowledge. Like, I know what needs to be done. Like, so I started doing my own research outside of LA and started talking to other colleagues across the country. So then I located a doctor in West Palm Beach, Dr. Tom Minus. It was a completely different experience than what I had. He took his time, like answered all my questions, really treated me as a human being. I felt where I was around, it was like quickly, okay, I got to get to the next patient. I got to get this. I never felt that like being rushed with him. He really explained to me, he said, this is what you got. This is what we're going to do. And I made the trip all the way to West Palm Beach from LA. And he really, after the surgery, when I went for my first post-op visit with him, I stayed there for a couple of weeks almost. He took so many pictures of the surgery. I saw the x-rays, what he did. I mean, my God, he did so much work. Like I was like, wow, this is unbelievable. And he showed me, he said, your last surgery, this is what should have been done. I don't even understand why it was done this way. Like he just really redid it. And it was, and the biggest thing for me after the surgery, which I was very scared, is, am I going to hear that sound again? Yeah. So the first 2 to 3 days, I was like, honestly, I was like PTSD. I was like trying to close my ear, like not to hear. Like I was like, I don't know, I was like traumatized. I was like, this is a depression. So then by like second or third day, I remember the PT came in the room and moved my leg. And I was like, wait, oh my God, I'm not hearing it. Even though my knee was swollen, I'm like, wow, I'm not hearing it. So then another 2, 3 days went by. I finally said, let me put my hand on my knee. So I started doing that. I'm like, wow, I don't feel nothing. Right. And I was like, first I thought it's like, is it me like denying it or is it not there? So then another couple of days, like I was like, it's really not there. It feels the same. So for the first time, I feel like the knee is moving the same as the other knee. I don't feel the pressure anymore, like that sound anymore. So it was like a little bit disheartening that I had to go, like, it's like, I have to go all the way to West Palm Beach.
Well, talk about the system in general. I mean, because on your LinkedIn, you have 4 paragraphs that sum it up. I mean, it's very profound. I just read it today for the first time. I'm almost, I mean, I understand the system. Sure. I'm not a surgeon, but I'm a physician, and I know there's a lot of problems, but I had no idea it was that bad. And where it was coming from, the problems actually. So can you talk about that a little bit?
I feel like, for example, I'll be honest, like, I was a little bit embarrassed to see, because I got this thing about the EOB, how much my surgeon may get paid. He got paid very little. And then I was like comparing to the last surgery, like they both, like this guy did 3.5 hours of work and he gets paid the same as the guy who did 1 hour surgery and didn't even do it right. So I feel like going down the reimbursement, I feel like people
there's no incentive
to do good work, because you're not going to get paid for all this extra work you do.
You got to have that incentive there somehow, some way.
There is no, to me, what is the problem is that the doctor, who I think is amazing, there's nothing differentiating him from a guy who just finished 2 years ago, who doesn't know even half the stuff this other doctor does, and they both get paid the same. Like, how is that even fair?
Why is that?
Because the insurance companies, they treat, whether you just graduated a month ago, whether you're doing it 30 years and you're the best, you're the same. To them, to me, what I've seen is that it's not about the patient care, it's about maximizing, to me, it's maximizing profit. Because if they did really care, they'll say, you know what? Yes, you should go see so-and-so because this guy has 30 years of experience, proven with excellent track record. And yes, we will authorize a higher reimbursement rather than a guy who just finished a month ago, who just graduated a month ago or a year ago. I think that's not fair. It's like, listen, in any profession, like even like legally, plumber, whatever, like lawyers, like, you have lawyers that come out. I mean, no lawyer that comes out is getting paid $2,000 an hour. The $2,000 an hour lawyers are proven veterans. They're proven, they have won, they have like an excellent track record.
But there's no insurance paying them.
No, but in medicine,
I think it's the insurance company.
You're the same. Whether the patient does well or not doesn't matter, the reimbursement. So unfortunately, many surgeons are like, they just want to do quickly. It's like become like a factor. I got to do my 5 or 6 cases because I need to make this much money, right. Basically.
There is a doctor I talked to in New York who I was going to do some work with, and he talked about how doctors were getting paid more money the less the patients went to the hospital.
Correct.
This is very good incentive, I thought, because you have to do your diligence, you have to really think about the patient. It's not just do it according to the way the laws say, and no matter what happens to the patient, as long as you did your diligence according to, I guess, the AMR, and no matter what happens to the patient, you can't be sued, or you could, but you basically have done everything right, which is completely false.
Yes,
it's almost
correct.
like they have these false pretenses to do the work regardless of what happens to the patient. This needs to be stopped.
So there's a lot of like, it's more like figuring out like the bonuses and the incentive, as you said, is based on not admitting to the patient, but it's not really keeping the patient like maximizing their health. You know what I mean? It's not about like, let's focus on your gut health. Let's heal you from inside out. It's about drugging you up to minimize the symptoms so you don't end up in a hospital.
Well, now we're talking about two completely different sets of medicine, which I want to get into with you because you're starting to go to more holistic, alternative, functional medicine, which is awesome. And we need an orthopedic surgeon like you that we can start sending patients to that's going to get those 3.5 hours and maybe more. Yes. So, but the system we really need, I think one of my ideas is that physicians, like you mentioned on your LinkedIn, we need to get together. We need to join together to stop these problems. But I think we need to join together to set up our own insurance company, a holistic insurance company paid by physicians with good hearts that really care about the patient. Because when you care about the patient, you're going to make money. It's just going to happen.
That's right. And I always said, my dad said, I remember the day when I was getting on the plane to go to medical school to Pittsburgh, my dad was a very prominent physician in Iran, here. Okay. He didn't practice, but he said to me, I just want you to keep in mind 3 priorities. He said, you're going to start your first chapter, and to the day you retire, I want you to keep these 3 priorities, he said. He said, remember how I practice. Number 1 priority, patient care. Number 2 priority, patient care. Number 3 priority, patient care. And I remember that. And almost fast forward 10 years later, when I was graduating from residency, one of my mentors, Dr. Miller, said literally the same thing. And I was like, wow, almost 10 years later, here's another physician, like, doesn't know my dad, like 2 different countries, whatever. He said, just focus on the patient care. Don't worry about anything else. You're going to be fine.
Do no harm. It's right in there. We all took the oath.
It will, you get rewarded. If you take care of patients, you're going to get rewarded, basically.
You get rewarded by energy, by spiritual
energy.
Exactly. And that's what
the
keeps
karma
us
you
going.
put out there. That's right. I've
money
seen that
doesn't
to be
keep
true.
people going.
No, that's only short term.
It's seeing the patient get healed and amazing health benefits and what happens in their lives and their children and their community. Yes. We lost this.
Yes, we have gotten away from that.
How do we get that back?
I think physicians have to start not being afraid. Standing up, people are afraid about getting retaliated. Retaliation is huge. They have to feel like they can speak up without getting retaliated. We've lost the priority. Let's make the patient the center of the focus. I feel it's more about basically putting people on an assembly line. Everybody fits a cookie cutter approach.
Yeah, but
this is how we do it.
None of them fit.
You want every patient should feel they're being treated as a individual, like a human being. We have to get back, getting people educated. That's the problem. It's not a lot of surgeons, like what I've seen. I was like that too when I came out. I'm just focusing on your spine. You got to focus on the whole human body. This is a human being you're operating on. And you have to focus on healing the person from inside out. You got to focus on optimizing their body, lowering the inflammation in their body. Yeah. We got to but the problem is that you got to allow physicians, to empower them to sit down and talk to the patients. When you're seeing 60, 70 people a day, how can you sit down and talk to people about that? You're not being rewarded for that.
I had 2 patients I'll just mention in my practice. So I do a lot of orthopedic stuff too. And the 2 patients would not heal. Well, they both had diabetes, but they didn't come to me for that. They're not coming to me for diabetes. They're just coming to me for there was back pain, intractable back pain, L4, L5. And we did the procedures. And I still remember that. And I had one come in the other day, he had the little knob on his stomach. And I was like, no, I'll treat you. But I'm going to tell you right now. And that's a question I wanted to ask you is, do you see the ones with diabetes not healing? Is it much harder? Because it's almost impossible with us.
Listen, diabetes we now know is just basically an inflammation.
So it's just much more inflammation. Okay.
It's a huge inflammation in the body. I mean, we know that high sugar in the body, it's a sign of inflammation. It's a chronic inflammation, basically. It's not most people are not born like that. It's through your diet, nutrition, and gut health, poor gut health, and it leads to whether it's diabetes, calcification in your arteries, neurodegenerative disorders like Parkinson's, Alzheimer's, and getting hypertension, and autoimmune diseases. You got to get autoimmune. It's a kind of an autoimmune.
It's the root of a lot of different diseases. But I because I'm not an orthopedist, so I'm a primary care naturopath, and I'm doing a lot of different treatments, and we do all different things. So, I see these 2 patients, they just stuck out of my mind how they would not heal. I mean, we're doing shockwave every week, Roar shockwave from Germany. We're doing PRP. We're doing a lot of other things, ozone, peptides. I couldn't get it.
Yeah, because the body's inflamed. They're so inflamed.
So
and
we're
I tell the
just
patients,
battling that inflammation constantly rather than having the patient heal. Okay.
Yes.
So anyway, that's a good thing. thing for everybody to know, that if you have the diabetes, it's just a horrific thing. It can really hurt you.
Or any autoimmune disease.
So you were telling me the other day on the phone how you're making your practice into a holistic medicine for people who need spine surgery or to fix the spine. Maybe they don't even need surgery. And because of what you did for yourself, right?
Yes.
More what you're doing now.
So what I did after my surgery.
Yeah, what did you do?
So back in 2013, I kind of was a victim of, or part of the system, what I call the Western medicine. So I was getting even though like literally my body fat percentage was less than 10%, but I was pre-diabetic. Wow. Like if you look me on the outside, you're like, wow, this guy looks in amazing shape. He's healthy. He had a six-pack. I'm playing soccer at a high level, semi-pro almost. But I was pre-diabetic, getting acid reflux, cholesterol out of control, LDL high, like all the bad stuff. And my friends around me were like, well, that's just the price of getting old. That's just how it is, genetic and stuff. So then that's how I got into this whole holistic functional medicine. There was a doctor, I know you've spoken with her, Dr. Tazib, Rochelle, right. And she's the one that opened my eyes to this whole branch of like healing people from inside out. Let's use food as medicine. My friends were trying to prescribe me something. She got rid of all of them. She's like, we're going to heal you from inside. We did a full gut analysis. So I had gut problems. I had no idea.
A comprehensive
stool test,
panel.
very comprehensive stool panel. Nobody's ever done it. And then she found a bunch of like fungus, like imbalance of bad bacteria. I had no idea any of this is going on, by the way.
Yeah, that's where your immune system is.
Exactly. I had no idea what this going on. And I learned subsequently that 70% of your immune system is around your gut. So if you have a bad gut, your immune system is like 70% is bad. She really put me on this pathway, and thanks to her, I started taking classes, going to seminars on functional medicine, integrative medicine. So I started learning. So at first I was a little bit skeptical because that's not what you're taught in med school, but I kind of trusted her, so I went along, and honestly it was a game changer. Like, my cholesterol has never been better, even fast forward 12 years later, even though I'm older. Even though it's 6 years I haven't been able to exercise, but I've still maintained a very good cholesterol. I check it. Like, all of my labs have maintained themselves. No acid reflux. I was pre-diabetic. Not even close to that anymore. She healed my gut, and I can, you can see the signs, what's going on with the inflammation. So I started to say, you know what? I want to implement this in my practice to my patients.
Nice.
So I started slowly, the more I learned about it, so I started educating nutrition. So now, basically, for the past few years, all my patients get a handout on what's called an anti-inflammatory diet. Good. Whether you are professional athlete coming to my office, or if you feel like you're in the best shape, or you're skinny like a toothpick, doesn't matter. I tell people you can have silent inflammation, and you don't even know about it. I tell people we're going to get rid of your silent inflammation, because the heart attack that you're getting when you're 60, it starts when you're 20. The Alzheimer's you get when you're 70 starts when you're in your 20s and 30s. So I tell them this inflammation is what's giving your joints inflamed, like your spine is getting inflamed. So I started educating people on the lifestyle, really holistic and stuff. So, and this is what I live by, and telling them natural supplements like black seed oil, cayenne pepper, ginger, turmeric, arnica, these modalities, and fixing your gut, really like focus on an anti-inflammatory food. That's a huge medication by itself. After my surgery, for example, I kind of went against my surgeon's protocol for the post-op, some of this stuff. For example, when I was in the hospital, he had me on 3 doses of IV antibiotics.
IV?
3? 3 IV antibiotic
Is that typical?
doses. That's typical. Surgeons
you just
do.
wiped out all your flora.
Well,
There's no more flora left in the gut.
So I refused the last couple of doses.
I mean, not you, but in general.
Yeah, no, exactly. So no, he has a protocol. So the other protocol, and he's not him, but it's many surgeons, they don't know. So then he had me on 1 week of Keflex antibiotic to be taken when I left the hospital. Oral. Yeah. By mouth. So a lot of people, surgeons do this. But as I said, I've learned that if you heal the gut right away, that's better than taking antibiotics. So I told him, and he said to me, he was like, are you sure? He's like, listen, we did all this work. I don't want this stuff to get infected. Yeah. I said, don't worry. I said, I feel very good about it. I said, I've been doing it. I told him, I said, I do incision maybe this big for patients who's had multiple scoliosis surgery, failed surgery, incision that big with all these rods and screws, and I only give them 2 doses, and that's it. Really? And I have not had any infection, any increased infection
But
rate.
You're also doing the natural stuff.
Yeah, the natural stuff
after,
too.
Right?
Exactly.
Yeah.
So, for example, in the hospital, honestly, I did not eat a single hospital food. I would Uber eat it.
nightmare.
And I
Oh.
asked the hospital, I said, can you Uber eat the hospital food? That's the other thing. You're not getting you're getting a lot of GMO. You're getting a lot of like the meat. It's not the highest quality meat. So I basically, for example, Uber eat like a grass-fed beef, pasture-raised chicken, pasture-raised eggs, the stuff that's on my anti-inflammatory. So I basically started eating that from day one. I did not eat a single literally, like for example, in the breakfast in the morning, they would bring me, I had French toast with syrup,
Man.
it's like, come on.
Their
you can't-
gut is totally mad.
Yeah, you
Sugar,
can't eat that stuff.
candida.
So my goal was to have my first bowel movement right away, because a lot of people get constipated, which is a sign of a bad gut health. So I literally had my bowel movement within 48 hours. So I knew my gut is back working fairly.
Did they give you, what was the medication they gave you for pain?
They wanted to give me
Narcotics, right?
narcotics. I
Yeah.
refused.
You know what happens with narcotics? Constipation.
Constipation
Big time.
kills your gut. It
Yeah,
kills your
yeah.
gut. I was not allowed to take even NSAIDs like Motrin Aleve because of the cartilage transplant surgery that was done to
Oh,
the stem
right.
cells and
Yeah, yeah,
stuff.
yeah.
I was only taking Tylenol. I had IV Toradol, which is fine. But when I left the hospital, I only had Tylenol, Lyrica, which is what I give my patients, and then some Tramadol. And I only took like 2 Tramadols the whole time. And then they gave me prescription for norcohydrocodone and stuff, narcotic. Never took a single one. And I was able to manage my pain with, as I said, cayenne pepper, ginger. I would get ginger shots every day.
Oh, you're getting ginger shots?
Yeah,
What
yeah,
about
that's a-
turmeric shots? Did you
No,
have
same
those?
thing. So cayenne pepper, lemon, ginger, turmeric
Oh,
shots
shots
every
like
day.
this?
Yeah, yeah,
Not
yeah.
injections?
No.
Oh, okay,
I
because
mean,
we
you
have
know,
curcumin
Yeah.
injections.
No,
Okay.
I was at my hotel room, so
That's
I went to
fine,
my
yeah,
hotel
yeah, yeah.
recovering. So there were a lot of healthy stores around, so I would Uber eat from them, and I would be my daily dose of so they had a lot of great health food stores, So I basically started Uber eating from them. I would get like fresh, cold pressed organic juice, certified organic juices, real stuff, not sugar
Of course,
stuff,
it's alive. Of
not
course you're
sugar,
gonna
yeah,
heal, yeah.
not that stuff. I did not. I mean, my surgeon was shocked. When he saw me my first post-op visit, like he couldn't believe how little swelling. My swelling has gone down, like how much I'm moving my knee. Like he just was like, wow. He was like kind of blown away. Like I said, I'm gonna like show you. He was kind of never seen this before. What I tell the patients, and I seeing it, like living it. I had a big whack on my knee. They took like almost 4 inches of bone cut. It's a very painful operation. It's a very painful operation. But if you, my point is that if you do everything like holistically, naturally, you don't need, am I in pain? Yes. Am I in pain right now? Yes, but it's tolerable. It's not the type of a pain, oh my God, I'm dying, just give me all these narcotics. No, it never got to that point.
When you're healthy and your gut is healthy, you're not that sensitive. The most sickest autoimmune patients, they're like so sensitive, you just touch them and it hurts.
I know, exactly.
The
like
more
anything.
robust
Yes,
you are, the more
yes,
robust your gut is,
yes.
the more, and that then you're more normal your hormones are. Your testosterone has to be at a decent level.
Yes, my
All these things.
testosterone was
So
good. Yes,
when
that
we
is
work with
correct.
patients, we do 10-page lab panel. We're looking at all that.
Yes, the free testosterone, that is correct, yes.
I got a question for you. Do you counsel patients like maybe a month before they're going to get surgery? Do you set them up to be healthy going into the surgery too? Like prebiotics and probiotics kind of thing?
Listen, unless they need emergency, it's fine. But usually I don't like to schedule the surgeries like right away. I like to like educate them. I said, let's optimize your body if they need. But the goal is to avoid surgery at all costs, because I tell patients like, if you can, like, let's heal you. If you can weather the storm, the pain, you just wait a little bit. Let's give it time a little bit. You never know. I've seen people get better, and I tell the patients, if you can heal yourself from inside out, that's better than anybody can do
This is
surgery
the
on you.
greatest thing because you're the only surgeon I've ever, actually, I know 3, but you're one of the only ones that ever said this. So that really, because the education, and everybody wants to listen to their doctor. They want to be friends with their doctor and they want to listen. And if the surgeon says, no way, you need surgery next week, blah, 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 I mean, they're probably going
Most
to do it.
patients fall into it. That's right.
If the insurance covers, they're going to do it.
That's
so
right.
we need
That's
voices like you, and we need you may even be part of that university or those courses that you went to as the surgery part of that holistic surgery, because that's a different animal than just.
That's not being taught. It's not being
Not
like
at all.
in like a lot of these major like centers. They're not really talking about any of this.
You need to talk to RFK.
Yeah, exactly. So I think we can really make, like, listen, if I can do incision this long and put all these rods and screws in you and you're not getting any narcotics, it's like, come on, you don't need narcotic for like a simple, like other surgeries, you don't really need it. Because if you can, do this, like we are going to lower our healthcare costs so much because people are getting healthier. Like there's no incentive for that.
Well, they're not. The health span, the lifespan is completely different now.
Yes.
That's the problem. I mean, we have little niches, of course, in certain cities like West Palm Beach and Arcadia and Pasadena.
There is no incentive to get really people healthy from inside out. There's no incentive
Number
because
one.
all these things that I told you I spend with the patient, there's no reimbursement for it.
Right.
You don't get nobody's reimbursing me. Oh, doctor, great job. You're talking to the patient. No, they don't. It's like, no, they don't care.
No.
It's all about like how many patients so these guys on these things, they have to see as many patients, do as many surgeries. You got to it's about maximizing the profit.
That's going to burn out eventually. But we need to have another system ready to go, and you're the beginning of the other system, as I am too.
I hope so. I had some great mentors in my residency who all like this principle about patient care. None of my attendings in residency, I would say the core attendings that we rotated work with, their focus was on patient care. They were not really familiar with this holistic stuff, and I didn't know at the time. I learned, but they were very patient. They were not about like let's push surgery. They tried to do conservative modalities, and I think those same surgeons, if they learn about this holistic, they'll get it more.
Their hands are tied, and they don't know the new system. And I tell my patients all the time, "Oh, my MD or the allopathic medicine gave me this." I say, "Look, those guys, they don't know what we're doing. They've never done it.
They've never
How
done
could
it,
you
no.
trust something if you never did it?" I totally get it. I wouldn't trust. I'm so skeptical now about all the supplements and everything out there because there's so many hoaxers. There's so many people for money, and you see that every day. I say I need to see the ingredients, and I need to see the capsule. I need to smell it. I need to taste it. I need to try it. Correct. Then maybe I'll buy from you. We need to really fix this. It's
the other
big
things
problem.
that I feel as most doctors have forgotten, like kind of got away from why they became your doctor.
Yeah.
Your job is to help patient keep getting better. Like many doctors, I feel like they learn and they basically get stuck in their ways, and they're not. I always, one of my mentors told me, the same mentor, Dr. said, no matter every surgery you do, even if it's the perfect surgery, even if the best outcome, he said, always think, what else could you have done? Always keep pushing yourself, like keep pushing to see if you can do a better job. Is there another alternative can you come up with? So I would tell you now, I'm doing many things drastically different than what I did 20 years ago.
Good.
Like in a better way, like more like skills that I've learned, didn't know before. Like I kept pushing myself to like learn about this whole endoscopic surgery that wasn't around, started innovating that, coming up with other innovative ways of doing things that has never been done before. And yeah, it takes a lot of work, and yes, you don't get reimbursement for it. But you know what? It's not about that. It's about the patient care. It's about like do the right thing for the patient, and you can't be changed with like money cannot guide you. I'm going to do this on this patient because insurance is not going to pay me for this, so I'm going to do this. No, that's the wrong answer.
You've spoken a lot about this industry, what you've seen, what happened to you as a patient. What's the next step in Dr. Hooman's life?
My vision, I wish I could really get, and it's like sort of, I tried it before with members of the Congress. There was back in 2019, there was a senator from Colorado, Senator Cory Gardner, which I actually spoke with him about some of these issues. And he literally soaked it all in and literally, gave me his personal cell phone and said, you know what, this is amazing. I know I can get bipartisan support for this. It's like nobody's ever said this. You have all these fresh ideas of what to do, like incentivizing like patients, like changing like Medicare, like help Medicare work for the patients, basically. Make competition so the insurance companies are not controlling these monopolies, basically. Exactly. Start empowering the doctors. So I gave him bullet point, and unfortunately, this was December 2019. And then right before COVID, and then COVID happened. So we kind of, like he said, basically, I'm sorry, I got to deal with this. And then he lost his race, and that was it. So since then, I've tried to talk to, doesn't matter, both sides of the aisle now, different senators, assembly, whatever, in California. And it's like, honestly, talking to deaf ears. Like, they're not interested. They don't understand because they do not have to deal with what most patients deal with because they have what I call like the Bugatti, the Rolls-Royce of insurance plans. And they think everybody has that.
But insurance plan isn't going to do the best surgery on the knee.
No, of course
So
not,
they're going
no.
to have a lot of problems that you had, but maybe they haven't had that severe yet. Or usually what happens is their child gets healed by natural medicine or something that's not an allopathic drugs or surgery. And they're like, oh my goodness, and they have a lot of clout. They're important people. That's when things start to spread and change.
Correct. So I was trying to starting to understand, we got to focus like at the root cause, like going back to like what some of the RFK is doing with the kids, getting them healthy, like getting the meals in
Just the
school.
research to
I
say
think on that,
does
yes.
those medicines even work? Because the research I don't think has ever been done.
No. And also, most importantly, let's get these doctors educated in medical school. Like we have to have curriculum on these whole holistic. There's nothing about this. It's all about like you have this problem, either you get a drug or you get a surgery.
Well, when the nutraceutical companies have to start maybe help fund some of the bill too, because if it's just the pharmaceutical companies giving money, then they're just going to say, well, it's our deal. We're just going to.
That's what it is.
I don't know if there's a law, but it seems like that's what happens.
That is correct. So we need to, doctors need to get educated, and I think there needs to be rewarding doctors who have good outcome. They should get rewarded.
Yeah, like we said in the beginning, that other doctor had set up a big practice with a lot of physicians, and they reward them. The less visits to the hospital, the more money they make.
Yes, that is correct.
This is definitely incentive. Think about it.
Yes, that is correct.
That's awesome.
Yes. Good patient outcome, like good surgical outcomes. Like the data is there. Like the insurance companies have the data. They know who's a good surgeon. They know whose patients are doing well, coming back for repeat surgery. They have all this data out there, but it's like nothing. Like the good surgeons don't get recognized from the bad surgeons.
It's great having you here.
Yes, thank you. It's a pleasure. Yes,
You're a warrior.
Thank you very much.
Definitely.
Thank you.
We need
Thank you
more
very much.
warriors
Yes,
like
thank
you.
you. Thank you.
And maybe
More watchdogs.
Yeah.